Now, what are the various tests for the dry eye that you remember? So just name of the test I am telling you first. First is tear breakup time. Second, the most important one is the Schirmer's test, followed by two dye tests that are the Rose Bengal and the Lissamin green dye. Then remember regarding another test which was asked few years back, that is phenol thread test, and the new techniques like meniscometry. So these are the various tests for dry eye. We would learn about the important features of all of them one by one. Now we would start with the tear breakup time. This is the first test that we do in a patient who has come to us with the dry eye. This is a simple OPD procedure. What we do here is that we put the sodium fluorescein 2% strip in the conjunctival sac. Then we tell the patient to blink the eye. So what it does is it basically spreads the sodium fluorescein now over the corneal and the conjunctival surface. After this, with a cobalt blue filter, we examine the cornea, and what we see is we see the first appearance of the dry spot. If this first appearance of dry spot that comes in less than 10 seconds, this means this patient is having a lucent deficiency type of dry eye. Okay. The second test that we do is the Schirmer's test. Now this is the most commonly done dry eye test in our OPD. How would they ask a question? They would just give you a figure like this and would ask what is the test being done, or then they can ask a question in this way that this test is being done and what is the layer that is deficient in this test, which we get an information. So the Schirmer test is basically done to know the aqueous deficiency dry eye. As you can see here, there is a strip which is put between the junction of medial 2/3 and the lateral 1/3 of the eyelid. Okay, so we have just retracted the eyelid, and in the palpebral conjunctiva we have put this strip. They ask sometimes what is the name of this strip. This was a previous year question, so remember the name. This is the Whatman paper 41 strip. This is a 35mm strip. What we do is we bend it at 5mm, put the bent portion inside the palpebral conjunctiva, and the 30mm remains open. Okay, after this we basically see the wetting of this paper for initially 2 minutes and then for 5 minutes, and according to that we basically interpret which type of dry eye the patient is having. So let's say the wetting of paper is less than 15mm, then we consider it as a mild dry eye. If it is less than 10mm, we consider it as moderate dry eye. If it is less than 5mm, we consider it as a severe dry eye. Okay, so this is the Schirmer's test. Now there are two types of Schirmer's test. According to the latest classification, this is the Schirmer 1, which is done without anesthesia. Okay, so what it does is it basically, as I told you when I was talking about the lacrimal secretion, that there is a afferent and a efferent nerve supply. So what is happening is when you are touching the cornea or you are touching the conjunctiva, because of the reflex secretion, there is a lot of water. So Schirmer's 1 is without anesthesia, so it basically test both of your basal as well as your reflex secretion. So the values would be higher with the Schirmer 1. So what is Schirmer 2? So in Schirmer 2, what we do is we basically put topical anesthesia inside the eye. So now after this, we stimulate the nose with a cotton wick. Okay, and then we get the secretion, and that secretion is basically just the reflex secretion. Okay, so it is with topical anesthesia plus touching or stimulating the nasal mucosa. These are some points you should remember regarding the Schirmer's test. Now this test was asked a few years back in your AIIMS exam. This was the phenol red thread test. What was the problem with the Schirmer's test? You have to put this strip inside the fornix. Okay, so the problem is that very young children or those patients who are having some amount of fear, it is not very useful for them. They won't basically allow you to put this Schirmer strip inside. We want a test which is more rapid and also that can be used in these individuals or even in small children. So here comes the phenol red thread test, where in similar way like we used to put a Schirmer strip inside the eye, here we put a thread inside the fornix. So basically we put a thread inside the fornix. The property of this thread is that as soon as it gets wet by the aqueous secretion, it changes its color. It changes into red color. So after some time, that is 15 seconds, we see how much is the change in color. So depending upon this change in color, we can basically define that this patient is having a dry eye. So less than 6 mm of the change in color in a phenol red thread test means that the patient is having a dry eye. So it is, what are the advantages? It is more useful in children. It is more rapid, and another important point is it does not use any anesthesia because it is so rapid, and just a thread which we have put, it does not use anesthesia. So these are the advantages of the phenol red thread test over the Schirmer's test, a previous year question. Now two more tests which are being done where we use the dye. So the first one is the Rose Bengal test. We studied about the Rose Bengal when we were talking about the dyes in cornea, and we also have a Lissamin green test, as you can see in this picture, which basically tells us about the conjunctival dry eye. So it is less toxic as compared to your Rose Bengal dye. And two more tests which are being done for basically measuring the dry eye. So first is conjunctival impression cytology, where with the paper we put it over the conjunctiva and then see the goblet cell density there, and we can measure the meniscus of the tear film with the help of machines as well. That is called meniscometry. So these are the new tests also being employed to measure the dry eye. So here we basically end this topic of dry eye evaluation, where we use the Schirmer's test, tear breakup time, phenol red thread test, Rose Bengal dye, Lissamin green, and conjunctival impression cytology and meniscometry.